Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Indomethacin. Indomethacin is a potent NSAID. Indomethacin is a potent NSAID and it is the long-acting NSAID. It is anti-chemotactic and immunosuppressive. Sorry, it is anti-chemotactic and it is immunosuppressive. It is well absorbed. This indomethacin will undergo enterohepatic circulation and it is eliminated by bile. Uses of indomethacin are: it can be used in acute gout, it is used in the closure of patent ductus arteriosus, it can be used in ankylosing spondylitis, and this is also used in sex related headaches. For sex related headaches, the indomethacin can be used. It is also used in Barter's syndrome. So indomethacin is used in acute gout, closure of patent ductus arteriosus, ankylosing spondylitis, sex related headache, and Barter's syndrome. So indomethacin is drug of choice for Barter's syndrome and for the closure of patent ductus arteriosus. Side effects of indomethacin is: it can result in frontal headache or it can cause paradoxical pain. Then it can cause confusion with GI upset or hyperkalemia. The patient can have agranulocytosis with renal papillary necrosis. There can be indomethacin and tramtarin can cause renal calculus also. So because of these diseases, so these side effects, it is contraindicated in epilepsy because of confusion, and it is contraindicated in psychiatric patients and also highway drivers. It is contraindicated in highway drivers and those patients which have hematological disorders, because it itself causes agranulocytosis. So if we give this indomethacin in the patient suffering from hematological diseases, then this can worsen the agranulocytosis. So thus indomethacin can be said to be the most toxic NSAID. The side effect, most common side effects among all, is the frontal headache, and this frontal headache or paradoxical headache is seen in almost 50% of the patients. But still, though it causes side effect of frontal headache, it can also be used for the treatment of sex related headaches. Next, it can also cause side effects like sedation can also be seen, and it is the drug of choice for ankylosing spondylitis, postcoital headache, Barter's syndrome, closure of patent ductus arteriosus. It is also contraindicated in epilepsy, neurological issues, the patients with psychological issues, or highway drivers or machine operators also it is contraindicated, and in hematological conditions it is contraindicated.
thank you and thank you for watching.